Hello, Grace Rizza here, and thanks for joining Dentistry is Growing with Grace. Excited today to talk about my favorite type of marketing. And this is the marketing you need to support your practice acquisition. So here you are, you just bought a practice, it is yours, and you are faced with a bunch of challenges immediately. The first is likely the retention or dealing with the turnover of the team. And then, secondly, the retention of your patient base. And then, thirdly, your marketing is how are you going to position yourself in the practice, in the community? And so, there's a lot of really bad advice out there. And I'm going to dig into my 15 years of dental marketing experience to explain to you what some of the common mistakes are, some of the bad advice that's out there, how you can identify and avoid that bad advice, and what you should do from a marketing perspective when you take over and own your new practice. So let's start. Do I have to market? Um, every situation is different, but usually with an acquisition, there is an opportunity to market. And I do recommend marketing, not just because I do marketing, but because I've seen that when a new owner takes over, a lot of times the new patient numbers start to drop. Why is this? It could be that the previous owner cut back on their marketing before they officially sold the practice. It could be that you've got change in team members that had relationships with patients and they're looking to take patients with them. It could simply be that the majority of the new patient flow was being generated by word of mouth marketing, and that was reliant on the previous owner's reputation. So naturally, in a lot of acquisition situations, you see a decline in your investment, in what you bought, in the momentum. And that's fairly normal. So you want to prepare for this. Next, patients have come to know and trust this previous doctor. So whenever there is a big change, whether you announce it or not, whether you try to keep it under wraps or not, word gets out. And depending on the type of community that you live in, sometimes the word gets out quickly. Most selling doctors write a letter to their patients introducing the new owner and explaining the transition. And a lot of times these letters are very heavily focused on the previous owner, what they care about, their values, and their legacy. And then at the end, there's a little tiny paragraph about the new owner. Oh, and by the way, I handpicked so-and-so to be your dentist. See you never. And those patients don't always stick around. And so that letter, a lot of times when I see it, I'm crying on the inside because a lot of times it's written to protect and announce the selling doctor, and it's not really written in the spirit of marketing for the new owner. And so we want to flip that focus around to be all about the advantages of having the new doctor owner in the practice. What are your core values? What do you care about? What new services or technology are you bringing? Do you plan to keep the team? We do have some marketing to support this that we've seen work very well on social media and other places. We might say, new doctor, same great team, same great care. There's a way to position this to where you're not hiding it, but you're painting a picture for your patients and you're telling your story in your words, in your way, instead of kind of sitting back and doing nothing for 6 to 12 months, crossing your fingers and hoping for the best, which is a lot of what's out there in terms of dental advice. I see this all the time. You know, my advisor told me or my broker told me to change nothing for 6 to 12 months. So we'll call you in a year when we're ready to market. And I'm always sitting there going, that doesn't make sense. These are the same doctors who tell us if we have a new team member that they want to know about it. So any little change they want to know about, they don't want to be surprised. But your patients don't want to be surprised either. So the first thing you can do is pick up the phone. Literally call your patients, make an introduction. 90% of them, you're going to get their voicemails. You're going to introduce yourself, ask for a call back, tell them you're looking forward to meeting them at their next appointment, and make an impression. You can send out a video to the patients explaining, again, your core values and your brand, and that you cannot wait to meet them. The kind of things you may not want to change is the dropping of insurances. You might not want to do that abruptly, or you could lose a large portion of your patient base. If you are planning to drop insurance participation, you first want to evaluate how many active patients in the practice are with this particular plan, and should I try to contract with them, or should I drop it from day one? And so that's got to be a calculated decision, not a rash decision, because once the patient meets you and builds that trust with you, it may be easier to phase out some of the lower reimbursing plans. So here's a quick tip to identify bad advice in the dental sphere. Anytime it's blanketed advice. So the example of telling an acquiring doctor who's just purchased a practice to not change anything for 6 to 12 months. That's horrible advice. Like, what if you have a toxic employee that you need to phase out so that you can improve morale and the culture of the practice? What if you have an employee who's working at the office down the street and stealing patients and sending them over? You don't want to keep that person just because you're not supposed to make any changes. If you have a horrible digital footprint, you've got no website or a very antiquated website with no real photography, no real connection, there's this huge area of opportunity to ramp up the marketing, increase the new patient numbers, and start adding value to your practice from day one. So in all of those situations, the advice to change nothing for 6 to 12 months is horrible advice, yet I see it all the time in groups, in forums. And so be very intentional with these decisions. The most important thing you can do as a new owner of a dental practice is give yourself the ability to make decisions. Give yourself a little bit of confidence as the owner to be a leader in this situation. If you fall into this position where you almost give away your power to your new employees, one, you're actually going to set a poor first impression, because you'll look like a weak leader and they won't want to follow you. So it's important that you embody the new role that you have as owner, take those decisions seriously, but then when you do make a decision, to stick to it and announce it and get their feedback on it without completely letting go of your power. So listen and absorb your team's feedback, but don't be, I guess, a complete victim of circumstance. You do need to be a strong leader and have confidence in your decision making. And in this area, you should talk to advisors. You should talk to experts like myself that have helped over 1,000 practices with decisions such as these, so that you're not getting into a situation where you're guessing or where you have a false confidence, because that will definitely be something that people can sniff out. And so when it comes to your marketing, start with your brand, identify your intended reputation, make sure that it's unique and true to who you are. It's very, very important that you don't just put out some marketing garbage and then you don't live by it. Any statement you make publicly, you want to back it up with action, with consistency, with behavior. So if you're making a statement that you are going to be the high-tech practice, you do need to look at phasing out paper charts. You do need to look at making sure you have digital x-rays and maybe even a cone beam, depending on what services you're offering and if that's a necessity. You may want to look at things like the wand or a different anesthesia options for patients, so that you can ensure they're absolutely comfortable and that this technology is not just for marketing but for the patient's benefit. So you want to live and embrace your brand. You don't want to just state it to attract new patients. Another thing to think about is think about what's going to be changing in the practice. Look at how the previous owner did things, how you plan to do things, even if it's slightly different, even if it's exactly the same, whatever it is, make sure that you are telling your story. This can be in the form of a video e-blast. This can be in the form of a video on your social media page. It could be in the form of a press release that we disperse for you on multiple platforms, so that when people Google your name, the previous owner's name, the previous practice name, the new practice name, that you're telling this story in your words in a way that's going to highlight you as the patient's best option for oral health care. So make sure you take control of your story and you tell your story that you are not a victim of circumstance. And other things to consider that you don't have to necessarily wait on if you are marketing in a proactive manner, meaning you are telling that story. You're going to want to look at the practice name, the logo, the tagline, the reputation, the website, the rankings on Google, the advertising effectiveness. So, what's already in place? How is it working? Is it working? Could it be better? New services, new technology, anything that you're bringing to the table that's going to enhance patient care, patient experience. We talked about the story and telling your story and leveraging public relations to tell that story. And then looking at the social media footprint. Does it reflect what you envision for this practice? And you can begin to make this practice your own from day one. Like everything, it starts with your mindset, and it starts with you taking that decision to improve things and taking the bull by the horns. And I am giving you permission, if you need it, to throw away the advice that is blanketed to all people, to set up a marketing planning session with me if you'd like. I'd be happy to take a look at your current situation, your marketing, your new patient numbers, your brand, and your vision for the practice, and come up with a plan and a timeline that makes sense for your situation to get the most out of your purchase and your acquisition. So congratulations on becoming a business owner. My name is Grace Rizza. I'm the CEO and founder of Identity Dental Marketing, and I'm happy to help you. So follow our podcast, join our Facebook group, both titled Dentistry is Growing with Grace, or visit us online at identitydental.com. Do me a favor, hit the follow, hit the like, hit the share, do all the things, and I'll keep bringing this great content. Thanks, and have a great day.